Before taking Zeposia, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once a day or every other day. Swallow the capsule whole. The dosage is based on your medical condition and response to treatment. Your doctor may direct you to start this medication at a low dose and gradually increase your dose to reduce the risk of side effects. Take this medication regularly at the same time on the days you are scheduled to take it to get the most benefit from it. Do not increase your dose or take this medication more often than prescribed. Consult your doctor before stopping this medication, as your condition may become worse if you suddenly stop taking it. Avoid certain foods and beverages that are high in tyramine, as these may increase your blood pressure while you are taking Zeposia. And always make sure to tell your doctor if your condition gets worse. Side effects of Zeposia may include back pain, dizziness, and lightheadedness. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. When you first start taking this medication, you may have temporary slowing of your heartbeat. Your doctor may slowly increase your dose during the first 8 days of treatment to decrease this risk. Remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. It may raise your blood pressure, so check it regularly. Zeposia may rarely cause serious liver disease, so get medical help right away if you experience symptoms such as nausea, loss of appetite, stomach pain, yellowing eyes/skin, or dark urine. It can also weaken your immune system and increase the risk of infection, so seek medical help if you develop any signs of infection. If you notice any very serious side effects such as shortness of breath, severe dizziness, vision changes, or sudden confusion, get medical help right away. If you notice any symptoms of a serious allergic reaction, seek medical help immediately. This is not a complete list of possible side effects, so contact your doctor or pharmacist for any concerns. Before taking the Zeposia starter kit, it's important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have any breathing problems, infections, diabetes, eye problems, heart problems, high blood pressure, liver problems, or if you smoke. This medication may cause dizziness, so it's important to avoid alcohol or marijuana, and to be cautious when driving or using machinery. It may also increase your risk of getting infections or worsen current infections, so it's important to stay away from anyone who has a contagious infection. Before starting treatment with this medication, talk to your doctor about your vaccine history and if you need to get any vaccines. If you need a live vaccine, it should be given at least 1 month before starting this medication. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using. Additionally, it's important to discuss with your doctor if you are pregnant or planning to become pregnant, as this medication may harm an unborn baby. It is also unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. Now let's talk about how to use the Zeposia starter kit. It's important to be cautious about potential drug interactions that may affect how your medications work or increase your risk for serious side effects. To avoid any complications, make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug are other drugs that weaken the immune system or increase the risk of infection, such as natalizumab, rituximab, and alemtuzumab. Additionally, it's important to avoid taking any MAO inhibitors during treatment with this medication. Your doctor can advise you on when to start or stop taking this medication and when it's safe to take MAO inhibitors. If someone has taken too much of the Zeposia starter kit and is experiencing severe symptoms such as losing consciousness or difficulty breathing, it is important to call for emergency medical assistance by dialing 911. Alternatively, you can contact a poison control center immediately. In the U.S., residents can reach their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center for assistance. It's important not to share this medication with anyone else. Before starting this medication, your doctor may conduct various lab and medical tests, such as complete blood count, blood pressure, pulse, EKG, MRI, eye exams, liver function tests, and lung/breathing tests. It's crucial to attend all medical and lab appointments and consult your doctor for more information. It's crucial to stick to your treatment plan as prescribed by your doctor. If you happen to miss a dose of ozanimod, it's important to consult your doctor beforehand. If you miss a dose within the first 14 days of treatment, you may need to restart at a lower dose and gradually increase it. If you miss a dose after the initial 14 days, simply skip the missed dose and take the next one at the usual time. Do not take a double dose to make up for the missed one. Make sure to store the Zeposia starter kit at room temperature and away from light and moisture. It's important to keep it out of reach of children and pets. When you no longer need it or it has expired, make sure to properly discard it by consulting your pharmacist or local waste disposal company. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.